What's the difference between Plan G and Plan N? Okay, so let me fill you in on that question. I get it asked all the time. This is Holly Cohen with Preferred Medicare Plans. I also run this YouTube channel called Medicare Secrets, and I have a Facebook group called Medicare Secrets because there's a lot of information out there that unless you know what to ask, you won't ask. So I try to provide as much information. I do call them secrets because I swear it's just not shared enough. They should be public. There should be public service announcements explaining how Medicare works. But anyway, a Plan G pays the 20% after original Medicare Part A and Part B pays the first 80%. A Plan G does not pay the Part B outpatient medical deductible, which next year for 2023 will be $226. So in other words, a Plan G allows you to go to any doctor, any hospital across the whole U.S., with the exception of a rare few. There are no networks, and the doctors and hospitals are direct billed to Medicare. Medicare pays the first 80%, and Plan G pays the 20% balance of the bill and all deductibles in the hospital. And you're only responsible for the Part B deductible. Part A is hospital, Part B is outpatient medical. So $226 for the year. Once that amount has been satisfied in medical costs, then you have 100% coverage with Plan G. Now, let's go into Plan N. So Plan N also works hand in hand with traditional or original Medicare Part A and Part B. It works almost the same way as Plan G. It allows you to go to any doctor, any hospital across the U.S. Again, almost any. There are a few that are managed care that do not allow original Medicare in. Very few and far between. So most places will bill original Medicare, the first 80% on a Plan N. And Plan N, you may have a $20 copay when you visit your doctor's office, and you may have a $50 copay at an ER if you're not admitted to the hospital. So those are two add-ons that are part of the Plan N. Plan N is generally $30 to $50 less expensive per month than Plan G. So a lot of people do go that route. If they don't go to the doctor very often, they like to do a Plan N because they may have that little copay of $20. Oh, also Plan N does not cover Part B excess charges. So what is a Part B excess charge? It is like this. Original Medicare pays an exact fee for service. So for example, an MRI, original Medicare has a specific amount that they pay towards an MRI. And if an MRI center feels that they have incredible state-of-the-art equipment and they would like to charge more than what Medicare pays them, then they pass that extra amount on to the patient, and they're allowed to do that up to 15% if you're on a Plan N. So Plan N does not fill in the gap or cover Part B excess charges, which is, again, the difference between what Medicare pays the provider for the service versus what the provider wants to charge for that service. So there's an excess fee called a Part B excess fee, and on a Plan N, the patient is responsible for up to 15% of that amount. Now, there are states that is illegal. There are about a handful, 5 or 6 states that are called MOM states, which stands for Medicare Overage Measure, where it's illegal for that provider, that outpatient facility, to charge more than what Medicare pays them for the service. So if you're in one of those states, and I'll provide the link below to that to show you which of the handful of states that is in the U.S., Plan N is an ideal choice, although you may have that little copay of $20 visiting the doctor. So if you're in relatively good health, Plan G is amazing. It pays every bill except for the first $226. Plan N, you may have a $20 copay at the doctor, may have a $50 copay at an ER, and you may be responsible for Part B excess charges, which usually doesn't amount for much. And I always tell people, if they're considering Plan G versus Plan N, remember, a Part B excess charge is a planned event. It's not an emergency situation. A Part B is an outpatient medical event, going to your doctor or going for outpatient surgery. It's something that's scheduled and planned. So you can simply, if you're on a Plan N, ask that facility or ask that doctor's office while you're booking the appointment Do you accept Medicare approved amounts? If their answer is yes, and you live outside of one of those mom states where it is legal for that provider to charge the excess fee, then guess what? If they want to accept what Medicare pays them and not charge you more than what Medicare is paying them, that's called that Part B excess fee, then you're perfect, you're fine. And again, so it's a planned experience when it's a Part B. So that's a good consideration. If you want to save money, Plan N is a very good way to go. If you have any questions, always please give us a call. Here at Preferred Medicare Plans, my name is Holly Cohen. And also I run the Facebook group, Medicare Secrets, to try to help seniors understand what is out there, what's going on, who's telling the truth behind all this stuff. You can always call us at 855-265-6334. I've been in Medicare since 2016, and I've been in health insurance since 2010, and I really give it my all and love to tell just the transparency of it all, okay? All right, everybody have a wonderful Thanksgiving, and I'll talk to you soon. Bye.